Evidence-based practice is a crucial tool for delivering high-quality patient care in numerous nursing specialties. Evidence-based practice enables nurses to apply data-backed solutions that incorporate clinical expertise and current research into the decision-making process. Integrating evidence-based practice into the daily practice of healthcare professionals has the potential to improve the practice environment as well as patient outcomes. It is essential for nurses to build their body of knowledge, standardize practice, and improve patient outcomes. Patients expect to receive the most effective care based on the best available evidence. The implementation of evidence-based practice allows nurses to provide quality patient care based on research and knowledge rather than based on traditions, myths, hunches, advice from colleagues, or outdated textbooks. To advance nursing science, enhance practice for future nurses, and improve patient outcomes, it is critical to teach nursing students not only the value of evidence-based knowledge, but also how to access this knowledge, appraise it, and apply it correctly as needed. How do we know if what we are doing is truly the best way to do it? Is it the best for patient outcomes? Is it the most cost-effective? These are questions that we must continually ask ourselves daily, and the answers often reside in published literature or in new research studies that seek to answer those questions. Evidence-based practice integrates the clinical expertise, the latest and best available research evidence, as well as the patient's unique values and circumstances. This form of practice is essential for nurses as well as the nursing profession, as it offers a wide variety of benefits. It helps nurses to build their own body of knowledge. It minimizes the gap between nursing education, research, and practice. It standardizes nursing practices. It improves clinical patient outcomes. It improves the quality of healthcare, and it decreases healthcare costs. Thus, clinical decision-making by nurses should be based on the best and most up-to-date available research evidence. The first documented use of evidence-based practice in nursing is attributed to one of the most famous names in the profession, Florence Nightingale. While not officially recognized as the founder of evidence-based practice, Nightingale's work is considered by some to be early examples of evidence-based practice in nursing. Following her work in the Crimean War, Nightingale was assigned to a Turkey-based barrack known for unsanitary conditions. In her journal, later published as Notes on Nursing, Nightingale documented her use of hot water and soap in patient care and showed statistics to predict patient morbidity and mortality. Nightingale infused her nursing practice with evidence with the goal of enhancing patient health outcomes. She was a pioneer of evidence-based practice within the discipline of nursing. One of the most important components of evidence-based practice is critical thinking, which is defined as a thinking skill consisting of the evaluation of arguments. It is a purposeful, self-regulatory judgment that interprets analysis, evidence, and methodology when seeking a decision. Used as a component of EBP, critical thinking means the provider should consistently evaluate how much to trust the findings of a given research study. EBP strategies allows nurses and other healthcare providers to translate research findings into clinical practice. With efficient literature searching skills and the application of formal rules of evidence in evaluating research findings, providers can apply existing scientific knowledge in their clinical practice for each individual patient. But why do we do what we already do? There was a time when milking chest tubes and bathing children in alcohol were standard practices. Although at the time the nursing interventions may have seemed rational, evidence-based practice has proven otherwise. Evidence-based practice continues to change the way nurses care for their patients. For example, During one of my clinical rotations, a seasoned nurse corrected me for not aspirating a syringe during an intramuscular injection. Current evidence-based practice research suggests that aspirating intramuscularly is no longer a standard of practice, since no evidence supports its practice and it can cause trauma to patients. One of the key points we learn in nursing school is about the importance of EBP. As students, we are taught to be a generation that provides high-quality care. This high-quality care is supported by evidence, which took many years to become standards of care through translation from research to clinical practice. Nursing EBP continues to expand, and several resources such as journals, models, and books are available to help nurses understand the concepts and processes. Gaining knowledge of EBP and learning strategies for implementation are critical skills for nurses, no matter the setting. Here are just a few examples of how EBP has changed nursing care. You can find many of these and more examples in the literature. The brat diet, bananas, rice, applesauce, and toast, is no longer a nutritional recommendation for gastrointestinal upset in children. The American Academy of Pediatrics now recommends that children be returned to a well-balanced diet as soon as possible. Nurse-driven protocols now guide nursing practice regarding the best time for removing urinary catheters to prevent urinary tract infections. Aspirin was previously used to control fever in the pediatric population, but it is no longer a standard practice because it increases the risk of Ray's syndrome. All of these examples show that sometimes we're just doing what we do because it's always just been done that way, and no one has questioned it. This should be scary to you, because if nurses hadn't done their research, we would still be drying out wounds with heat lamps. The evidence-based interventions we learn can improve patient outcomes, help to provide high-quality care, reduce costs, and eliminate practices that have become obsolete or are not effective. As nursing students and future nurses, we hold a promise of continuous learning, and it is essential to build evidence-based knowledge over time. As students, it is never too early to start thinking like a nurse now, who is driven by evidence-based practices. During clinicals, do research on the medical conditions your patients have. It will help you provide a higher level of care. Be proactive in suggesting EBP during clinicals or helping to bring more attention to EBP research.